Okay, welcome back to the afternoon session of the Georgia Accessibility Conference, day one. Our next group of panelists are presenting mental health initiatives in public libraries, the California experience. Lisa Barnhart has been a librarian for over 35 years, with the majority of her career focused on the development and delivery of training and learning for library staff in all formats. Currently, she is the project manager for California Libraries Learn, or CALL, a grant project providing continuing education for California public library staff. Carolyn Brooks is the Director of Library Services for El Dorado County. Prior to this appointment, she worked at the California State Library Development Services Bureau and administered multiple statewide grant projects to public libraries, including Early Learning with Families, the Mental Health Initiative, and Veteran Services at the library. Juliana Robbins has been working as a librarian since 2004, and in 2006, she completed her MLIS from SGSU. Her experience covers school libraries, youth services, reference, digital services, and branch and program management. She joined the California Library Association as a program manager in 2016 and California Center for the Book in 2017. Deborah Nicklick is a senior librarian at Monterey Park Brueggemeyer Library, who specializes in adult and youth services. Deborah has been working in libraries since 2005 and is certified in youth mental first aid. Deborah is also the author of Serving Teens in the Library, a Practical Guide. Natalie Cole is Bureau Chief of the Library Development Services Bureau of the California State Library, where she oversees the administration of state and federal grant programs for California libraries. Prior to joining the state library, she was the interim executive director of the California Library Association. She is the co-author with Virginia A. Walter of the book, Transforming Summer Programs at Your Library, ALA 2017. We welcome our guest speakers as they talk to us about a very important topic. Please join us as we welcome this team from California for mental health initiatives in public libraries, the California experience.
Thank you, Pat, and hello, everyone. Thank you very much to the Georgia Accessibility Conference for inviting us to speak, and thank you to everyone for coming to our presentation today about California's mental health initiative. Next slide, please. The initiative is a statewide project that was supported with LSTA funding from the Institute of Museum and Library Services, and it was a collaboration between the state library and public libraries across California. Next slide, please. I'm very glad to be joined today by our presenters, who are some of the amazing people who created and implemented the Mental Health Initiative. They're going to talk about how the initiative was developed and how it was implemented in libraries, and they'll introduce you to online resources that will help you do similar work in your libraries and communities. As Pat said, they are Lisa Barnhart, Carolyn Brooks, Deborah Niblick, and Juliana Robbins. And Carolyn Brooks used to work at the State Library and was responsible for the Mental Health Initiative when she worked with us. And she will begin our presentation by talking about how the initiative was developed and implemented. And over to you, Carolyn.
Thank you. So according to a recent health interview survey, nearly 1 in 10 adults in California suffer from functional impairment due to a mental disorder. This means 9% of all adults in the state are experiencing psychological suffering to the point of affecting their work and social life. And these numbers are pre-COVID. The World Health Organization states that the most common mental health problem is depression and will soon be the second leading cause of disability. We needed to normalize the conversation around mental health and make sure library staff was prepared to work in this arena. So the California State Librarian Greg Lucas committed funding for 3 years for the Mental Health Initiative, and our goals were: 1, that community members would have access to information and physical materials to gain further knowledge about mental health education and best practices for a healthy life. Goal 2, state library staff feel more confident in providing resources on mental health education and are better able to provide a centered approach to creating an atmosphere of kindness and compassion for all library patrons. And goal 3, to create a safe place for information and conversations about mental health wellness. Go ahead and next. So the first thing we did was examine the needs through research, data gathering, focus groups, and community conversations. We then created and developed surveys, distributed them to libraries across the state, and determined the most urgent areas of need. We then brought in mental health experts, online content creators, and library staff, and completed an assessment of the available tools and resources, and really found there was not enough available. So we got to work and we developed resources in the top identified areas because the needs were so overwhelming. Even in 3 years, we couldn't address it all. So we targeted a couple areas: training opportunities, created the online Mental Health 101 that Lisa will be talking to you about later. We had half-day de-escalation trainings right there at libraries so the entire staff could attend. We had mental health workshops at the state library conferences. Our second area of funding was for programming, and community partners were a required piece of that programming. So there were held across the state mental health resource fairs, targeted programming that included environmental scans and logic models to start off, and provided that assistance to library systems so they knew exactly what was needed and how to provide it. Third, we provided book collection development funding, and mental health was one of the targeted areas. Fourth, we developed new web pages and resources for the California State website, and Lisa will be covering that later. And last, we created mental health and wellness kits. For adults, we had 8 topics for these book kits that included anxiety, postpartum depression, mindfulness, PTSD, substance abuse, and more. For children, we created 12 kits, 2 of them in Spanish, on topics related to feelings. And they all included hands-on activities to go with the reading materials on empathy, kindness, anger, grief, resilience, mindfulness, and even bravery. And the last kits that we put together were on Alzheimer's and dementia. This was a set of 7 bags meant to provide support for caregivers and activities they could do with their family members who are experiencing these conditions. Lastly, and continuing, we have worked on evaluation. This is an iterative process as we develop materials and refining as we go along. We also started sharing our materials, which is a process State Library is still working on. So at this point, I'll go ahead and turn it off to Deborah, who actually got to participate in some of these initiatives.
Thank you so much, Carolyn. Good afternoon. My name is Deborah Niblick, and I'm the Senior Librarian for the Monterey Park Bruggemeyer Library. I'm super excited to share with all of you some of the work that my colleagues and I have done at the Pasadena Public Library and also at the Monterey Park Bruggemeyer Library in regards to mental health. One thing I wanted to note is, as library staff, we can start a conversation with youth, specifically youth, about mental health by creating programs and services to help them manage their own mental health, but also guide them to resources to advocate for their friends and their family. I also want to stress that we are not mental health professionals and are not obligated to treat or diagnose, but what we can do is connect youth with those who can. So, This is obviously the reason why we need to talk about this, is because if you look at these statistics, about 50% of youth ages 14 and older will drop out of school because of a mental health disorder, and about 75% of all lifetime cases begin by age 24. So early intervention in the adolescent years is important for treating mental health disorders. But also the more staggering is 77% of death by suicide is amongst young Black men. So this is a very, very necessary topic to talk about in our buildings. So In 2016, the Pasadena Public Library, we have a teen advisory board who held their annual strategic planning meeting focusing specifically on teens populations they are not serving. And after a brief conversation, the teens unanimously identified teens experiencing mental health disorders as the population that they would like to reach out, because the first thing that they pointed out was that in order for anyone to be successful in any capacity, mental health comes first because it is a foundation and it's essential. So the reason why the Teen Advisory Board wanted to explore this particular group of teens is because they found it as a very real and a very relevant issue. And in fact, some of them even disclosed some of their own experiences with anxiety, and one was brave enough to talk about her struggles with depression. So based on these particular experiences, they saw this opportunity to start a dialogue, but also provide information and even life-saving resources to their peers, which actually tied beautifully into the Teen Advisory Board's mission statement, which is to provide teens in the community with support through education and entertaining events, provide opportunities and resources to close the engagement gap, but also prepare teens for a successful and fulfilling life. So in that meeting, we stepped away for 20 minutes, and these are some of the ideas that these teens came up with, which, as you can see, are some amazing ideas, which are counseling services, create a mental health resource center, create a book and mentor club where teens can get paired up with an adult or even with someone slightly older than them that kind of understand where they're coming from, workshops and awareness events that we actually organize with our partners, but adding to the collection, specifically the fiction collection, to expose teens who don't quite understand what mental illness is. It's a great conversation about that if you want to talk about it later. Just don't have the time right now. So in order to get this teen mental health initiative that our tab wanted to embark on, we needed help. And the first thing that we turned to was our local public health department, who coincidentally was launching their own teen mental health initiative in the form of something called Project Wraparound, which is to provide youth ages 0 to 21 and their families with mental health services that cannot be accessed through a traditional care provider, i.e. folks that don't have insurance or they just don't have the means to pay for the care. But they also wanted to focus on the LGBTQ community, as they are 3 times higher to develop mental illness. So by partnering with the public health department, we were actually able to send staff to competency trainings and even youth mental health first aid, where 8 of us were certified. And we even co-sponsored the first annual Pasadena National Coming Out Day, which was part of public health's goals with their grant. In addition to partnering with the public health, we connected with our local chapter of NAMI, who were ecstatic to assist us in getting this initiative off the ground. We also even partnered with another community group called the Pasadena Mental Health Advisory Committee, which is a volunteer group of mental health care providers, advocates, and parents and adults who think this is important, to see how we can focus on youth. And through our conversations, we actually hosted their annual mental health day and included a resource fair and programming for teens. And lastly, we also partnered with another group called Teen Line, which is a nonprofit based out of Cedars-Sinai Hospital here in Los Angeles. And they provide a peer training and a training for teens to conduct a peer-to-peer hotline to listen to teens, but also connect them with care if absolutely necessary. And they were imperative because I was able to connect them with our next partnership with the State Library. So while all this was going on, the State Library put out their amazing mental health initiative and we jumped on it. And I was actually asked to be on the advisory committee to provide training for youth library staff. And I was able to connect the State Library with Teen Line to provide 2 trainings on Mental Health 101 and for suicide prevention. And last but not least, we definitely had to put this out to all of our staff because we actually have a lot of people who are very interested in this topic. So, and it was through these partnerships, these opportunities, where we got to send folks to trainings and to webinars and even, to present presentations at CLA and even ALA. I was able to do that with my colleague. So I got a lot of information here, so if I'm talking really fast, my apologies. But here's some steps on how to build your own teen mental health initiative, which is you want to educate yourself, but you also want to educate your teens. And you need to ask the professionals for assistance because as much as we want to say we know everything, we don't, but they're the ones that can guide us to what we need to do next, which is doing the research, finding out what's happening, what's going on in our community, which will help us create the plan that we need to launch to create this mental health initiative. And what else is another thing that's important is that we really do need to engage our fellow staff members, even if they aren't interested in youth mental health. At least they're aware of what we're trying to do, so they can at least guide teams to the staff who know what was going on. But we also really need to get the support from management, because they're the ones that can really get you connected with the inner workings of your city departments, but also their networks with other libraries and with other, even some mental health organizations. The next step is that you want to create a safe space. Declare your teen spaces as safe spaces for those who are in need of refuge, and make sure to enforce the behavior policies where harassment is not allowed, and make it very well known that discrimination will not be allowed in these spaces. But also you want to make all of your materials. So we did create a mental health resource center, and we created right smack dab on the 4th floor in the teen area to make it easily accessible, because anonymity is super important, because for some teens, mental health disorders can be a sense of shame. So if they can just kind of casually walk by and pick something up, then that's fine. So definitely make that as easily accessible as possible. But if that's not a possibility, create your own virtual resource health center. If you have some sort of LibGuide or some space on your webpage to create a list of mental health resources, make that accessible for teens who are just casually looking for information. And another thing is that you're going to want to bring in your partners to adapt and implement new programs and services. You don't have to recreate the wheel. If you can add a mental health component to your program, then go ahead and do that. And it's actually really good to invite your partners, because they can provide the informational aspect if you're not comfortable in doing that. And offer different types of programs in regards to creativity, you know, art therapy, or even your book discussions, you know, include a title about mental health. And last but not least, you need to share your success. No matter how big or small it is, share it with your colleagues, because it could inspire someone to do something different. So be proud of what you're doing and let us know. So I'm actually running out of time, so I'm going to quickly go through this. Mental health conversations. This is what we've done at the Monterey Park Bruggemeyer Library. So this is a bit of a breakdown of my city, and as you can see, is predominantly minority. And based on that, and these are just some statistics about that are a little bit staggering amongst the Asian Americans, that it's one of the leading cause of death for Asian Americans between 15 to 24, which is the teen years. It is also the second leading cause for death among Hispanics. But with COVID hitting and with everything going on, the anti-Asian hate incidence is driving up mental health cases as well. So prior to the pandemic, we actually received funding through the Mental Health Initiative to put on a fair and a program to talk about mental health, because especially minority communities, this issue is still taboo, and we wanted to start that conversation. So we partnered with some of our partners to provide that, but COVID hit, so we kind of had to quickly adapt. And then that's when we moved to our next one, which is we still provided mental health workshops to provide assistance during the pandemic, which focuses on depression, anxiety, and how to assist youth during a crisis. So those plans may have been delayed, but we're going to still do it this year, because coming in May, we've partnered with the same partners to provide a two-series event to focus on the art of forgiveness and non-medicated sleep techniques, but also an art therapy program, as well as a panel discussion on how to destigmatize mental health in the Asian community. So that's pretty much it in a nutshell for me. I think I'm running out of time. So I want to thank you so much for attending, and I'm going to turn this back over to Carolyn Brooks, who's going to talk about some of the work that she's done.
Okay, and there we go. So I'm the director of the El Dorado County Library System, and El Dorado County runs from the edge of Sacramento all the way over the Sierra Mountains to South Lake Tahoe. We're very, very large county, many isolated and rural areas where dial-up doesn't even work. So it's a place that we really knew we needed to come together and work as a team. So we created community hubs where families are healthy, caring, learning, and growing. Our library staff were all participated in the mental health initiative, 101 training, de-escalation training. They were trained in touch points for libraries so that we could be ready to do our best work for our community. Next. So what are community hubs? 5 years in the making, over a decade working with our partners. We have a library in every supervisorial district, and we have 5 Board of Supervisors with their districts. And we created community hubs that are a network of agencies physically located and based in the local communities at the libraries in order to meet the needs of their specific communities. Our goal is that all children, individuals, and families will live in nurturing communities and are ready to succeed in life, and that all systems of care are aligned, coordinated, and family-centered. Next. So our hub teams, next slide, include the library. We have early childhood education specialists who focus on early literacy, which includes math, science, reading, and motor skills. We work with our health department. Our public health nurses do advanced case referrals for families with intense needs. We have community health advocates that help families get access to health care, food, housing, provide health tips and activities with children and their families. We work with our County Office of Education, and they provide family engagement specialists who work with parents on nurturing and attachment, parental support and education, and also provide ASQ, ages and stages, developmental screens, and help family when issues turn up and make sure that early intervention is in place. Leading this all is our First 5 El Dorado, our systems change leader. And First 5 El Dorado is run by tobacco tax funds here in California, and every county has a First 5. And the funds are to be used for children only 0 to 5 years old. Next. So we did not have a huge pot of money to start. What we've really done is a very complicated blending of funding streams. So you can see a list of all of our partners there. I won't read through all of them. But the goal, once again, is building resiliency with families through collaborative, community-based prevention and early intervention services, utilizing trauma-informed approaches. Our systems change leader, First 5 El Dorado, facilitates county-wide collaboration of local nonprofits, government agencies, private companies that all work together to best utilize our limited resources to meet the needs of our families and caregivers. Next slide. Community hubs offer classes, groups, and activities for expectant parents and families with children 0 to 18. Because of the inclusion of our County Office of Education, we could stretch that 0 to 5 to 0 to 18. Staffed by an incredible team at every site of family engagement, literacy, and health specialists. Using surveys, community analysis, evaluation, pilot programs, and an iterative process, we work together at each of the hubs in targeted areas of need for that specific community. And this includes educational story times that target special ages and groups. We provide caregiver and childcare supports. The library visits daycare providers at their homes, and our education partners visit caregivers that are more formally organized at their sites and provide supports. We connect them to social services. We provide access to preventative health and dental care. We provide training and resources so we have high quality childcare for all families. Our daily reading routines have resulted in El Dorado County being one of the top in the state for parents and caregivers reading to their children. We provide the developmental screens and kits that go with those screens so that families have all the materials they need to complete those. We hold parenting groups with all of our partners at the library and out in the community, and we focus on early intervention. Next slide. So we are looking for improved child development, which means children birth through 5 are cared for in high quality environments. We're aiming for improved family functioning. So children birth through 5 are read to on a daily basis. Parents of children birth through 5 use positive strategies to guide and teach their child. Next. Improved child health. Children birth through 5 have timely well child visits. Children birth through 5 have semi-annual dental visits, starting even before they have teeth. And children receive early screening and intervention for developmental delays and other special needs. What happens is this provides a system of care of families engaging with community hubs, building resiliency. Next slide. Now we're currently working on Community Hubs 2.0, and during COVID, our hubs performed above and beyond anything we could have expected. We created distributions for PPE to our caregivers and providers. We provided food and diaper delivery to families in need, and that's still ongoing every month. Our expectations for what we wanted from our community hubs really came to fruition and blossomed during the past year and exceeded any of our expectations. Our teams were able to pivot quickly and perform that iterative process of really dialing in onto what are the most intense needs in each of our communities. So moving forward, we're going to be prioritizing our vulnerable populations that are most isolated and have lack of access. We're going to expand our health and service navigation supports. We're going to continue to design services to meet community demands and have community information groups that will be helping us with that as advisors. We continue to monitor and adjust services as needed to ensure supports meet the individual needs of those most at risk in our communities. And foremost, be a leader and voice for systems change and providing services for those who need them most. And we are now expanding from birth to death. It will be all ages, and we're really excited about this new chapter as we move forward. And now over to Juliana.
Thank you so much, Carolyn. Hi, everyone. I'm Juliana Robbins, and I am coming to you from Long Beach, California. And I'm excited to share with you for about 10 minutes, reminding me to start my timer, a little bit about how California Center for the Book was involved in the mental health initiative. So first of all, California Center for the Book, just in case you haven't heard of us, every state has a Center for the Book. We all do a little bit different things, but here in California, we work with public libraries, and our goal is to get the libraries and library staff members of California to help their communities read and connect, with a real focus on the connection part of it. We provide professional development, training, and an opportunity for the library staff members participating in our initiatives to collaborate together and talk about how they're implementing community partnerships and how they're working in their individual communities. So the sharing that happens sort of behind the scenes is really important to all of the programs that we do. And also community partnerships are essential to all of the programs that we do. So we are linked into California Library Association, which is a statewide library association, as the name implies. And we're also part of the Library of Congress Center for the Book. We work closely with the California State Library and colleagues here. Next slide, please, Deb. We started working with the state library on the mental health initiative. There was a lot of players involved. We were really excited. We were called in because we always work with community partners, and we focus on programming that reaches both adults and intergenerational groups. But that doesn't mean we leave out youth, because I think it'd be hard press to find families or communities where adults don't impact the lives of youth. So our plan was that this initiative was going to focus on sharing programming ideas and fostering community partnerships. There was going to be 4 months of training, and we selected 20 library jurisdictions. So that's not individual library locations, but library jurisdictions. And I believe there's 180 some library jurisdictions in California. I think you guys have 60 something. And each library jurisdiction selected 5 staff members. So each library jurisdiction had a nice team of 5 staff members. They may or may not have been physically located in the same building. They tended to be across the board, from youth services to technical services. And it wasn't just librarians. And I think that's important because we wanted frontline staff. We wanted people who had a ton of experience and people who were new. So we were engaging the community through selecting different staff members who had strengths in this area, or we thought would be good parts of the important team. And we were going to offer a chance for everyone to come together in person and share what they had been working on during the mental health initiative. And that opportunity would have been part of the 4th annual Adult Services Symposium. So that is typically an in-person event that we hold once a year, where 150 or so, maybe more, staff members come together from across the state and talk about community partnerships and programming for adults and innovation in adult services. So we were going to share what we had been working on with the mental health initiative, because that really was important to us. And giving people a chance to share what they learned was like key for all we do. So all of this training and sharing and collaborating was going to culminate in May, which is Mental Health Awareness Month. Perfect. Worked out with the calendar, very themed. People are already aware of Mental Health Awareness Month in general. So that would have been great. And if you could go to the next slide, please, Deb. As you all know, best laid plans, right? So come January or February, you guys will remember we started to hear news of this COVID-19, which I don't even think was called COVID-19 at the time. And we had to, I'm going to say it, pivot. So we had to change our plans and kind of adjust and see what we could do. It was really a lot. Some people, we weren't sure if the library was still going to be open. Were they going to be deployed here or there? But the reality was that despite all the challenges, despite the intense pressures of moving everything online overnight, the majority of the libraries that participated and the staff members that participated were able to complete the training, and they also were able to do a public offering or a public programming of some sort in May, which is amazing, or also some of them had to push that to June, which is, as you would understand, completely logical. So if we could go to the next slide, please. So one of the things that we worked on, and this is sort of a very fun thing to do for any sort of librarian or person who likes to research books and connections, we came up with the Mental Health Initiative book list. We worked with the state library, we worked with the participating libraries, and we worked with Ingram Collection Development to come up with what started as a massive list. We narrowed it down and narrowed it down. We wanted to make sure we had books for parents to read with their kids, so picture books that talked about mental health. We wanted to make sure that we had a diverse list of authors. We wanted to make sure that we approached mental health from all sorts of different angles with this book list. So what we ended up with were 66 individual titles, but 78 books. Why is that? Because there are 3 featured reads, and so of those, there are a few more copies. That's what made the 78. On the link here, there is the full list of all 66 titles, and also we have a Excel file that you can download if you are interested. Could we go to the next slide, please? So we started out, we wanted to start at the beginning. It's always a good place to start. And in January, we wanted to focus on understanding trauma. So we're understanding where people are coming from. I highly recommend each of these books, by the way, to add to your personal reading list. If you haven't read any of these, all of these were great. In January, we focused on The Deepest Well, and that was exploring ACEs and understanding where people are coming from with the effects that childhood adversity has had on people's lifelong experiences. And then in February was Trauma Stewardship. This is a great one, a short read, The Age of Overwhelm. And I think this is one we could all benefit from about right now, especially after this last year. And then the third was to tie into our Adult Services Symposium, this really great book by Priya Parker, which if you haven't read it, do check it out. She also has a great newsletter and a blog about the power of gathering and using those gathering spaces, both in person and virtual, in really powerful ways, and thinking about what we do. So that tied into the March event, which March of 2020, what was happening? Next slide, please. March of 2020, nothing was happening in person. So we retooled what libraries were able to do, ending up being mostly in May and some in June. There are a whole list of different community partners. There are 3 that I think, no, there's 4 that I'm going to feature here. One is Calexico. It's a small library, very underfunded. They were able to come up with something specifically for teens about reducing anxiety. And as you understand, this has been really important to continue this sort of work. And I think Deb mentioned too, creating sustainable partnerships, that each May for Mental Health Awareness Month, you can come back to these community partners and you can work with them throughout the year. Let's see, there was also at the Alameda County Library, they had a facilitated community counseling session. And next slide, please. Pasadena Public Library, I'm almost at time, so I'll talk quick. Pasadena Public Library had summer recovery, and then San Jose Public Library, they also worked with NAMI on a series of great events. So these are all saved in our slides. You can read them a little bit more closely later. Could I go to the next slide, please? And I wanted to just emphasize that this sort of project is something that's ongoing. It's not a one and done sort of deal. Mental health and support for mental health services is ongoing and important issue to everybody in California. This year, California Center for the Book is continuing to work on Book to Action, and we're focusing on 3 main areas: equity, health, and sustainability, with a real focus on health of the intersectionality between mental health and physical health, and not only that, but equity and sustainability and climate justice. So we're excited about the work that's going on there. We do have a featured speaker coming up soon. The link is included if you'd like to learn a little bit more. And I think I have one more slide. So I grabbed a quick screen grab of Burbank Public Library, which is doing a whole series based on maybe you should talk to someone. And next slide, please. The link is there that shows all of what they're doing, from a panel discussion to a clinically guided book club, a book discussion, food and mood, yoga for mental health, and an online program with the author. And that's just a short list and one example of what the libraries are doing through Book to Action and other initiatives across California. And next slide. Now I am happy to welcome Lisa.
And I am just going to jump in here because Lisa's internet just went down.
Oh, I saw a text from her, but
Yeah, so I think she is trying to log back in now. I don't know if we're able to take a few questions while we wait for Lisa to get back in. Is that something, Pat, that we might be able to do?
Yes, if you would like to handle some questions, that'd be great.
We will do that and give Lisa a few minutes to try and get back in to tell us about all the great resources she's going to be promoting.
I invite people to type questions into the chat box, and we'll be monitoring chat.
And also thank you for putting the book list into the chat in response to Charlene's question about the book list.
Okay, someone asked, are you using social workers or social worker students in your libraries?
Not necessarily. At Pasadena, we actually hired a case manager. So the only difference, so for social worker, you have to have a master's. So there are folks that don't have a master's that are case managers that know how to navigate services. But if you can, I know here in, especially in LA County, we have the Department of Mental Health that actually embeds social workers into various cities to assist with mental health situations, but also to work with libraries as well. But a social worker technically isn't required, but they have the know-how to come when it comes to treatment and diagnoses.
Some of our libraries do have social workers in them. And oh, Lisa is back. I just wanted to also jump in and say, I think we should do the presentation now in case she goes again. And then go back to the question.
I'm working off of my phone as a hotspot, so let's hope that it holds. Were there any questions about the resources? Does anybody need to know anything more?
Not yet. And also I'm going to say Carolyn has volunteered to, if you disappear, Carolyn will jump in and do the rest of your presentation. So thank you, Lisa.
Okay. Did you want me to do my part still?
That would be super. Thank you. Yes.
Okay. Thanks, everyone. Sorry about that. First time the internet's gone down, and of course right now. So just wanted to let you all know that there are lots of resources that thankfully came out of this wonderful initiative at the California State Library and with the California Library Association. You can see the URL there for the library, California State Library website, where they have a beautiful series of pages with all kinds of information, statistics, the mission for the Mental Health Initiative, and wonderfully a series of webinars that that were done as one part of the Mental Health Initiative on a number of different topics. We'll talk about that a little more in just one second. And then also the organization, the training organization that worked closely with the initiative was InfoPeople. And they now have in a self-paced platform a lot of the materials, including some great curriculum that came out of 4 months of cohort training that was mentioned. So next slide, if you would, Deb. So if you go to those locations that were listed in the in that slide, you'll see, for instance, on the State Library Mental Health Initiative site, there are 10 recorded webinars, and they include a number of topics, and you will see that they have a short synopsis of what those are about, a little bit of an interview with the people who were the presenters. They would make a great training for a staff development day, just even to look at and watch as a group and then talk about the concepts and the presentation. Also in the InfoPeople self-paced platform, there are 2 different things that you might find very interesting. One is From Compassion to Action. That was actually a self-paced training that we requested or required for those who were participating from libraries in the Mental Health Initiative. It's an excellent way for people to get a good overview of things like language, of the way that you should approach patrons, trauma-informed, all of those things. So I would encourage all of you to check that out and see if it's something you might want to even assign to your staff or others for an individual training, but also as a group if you choose to. The really more lengthy one is Building Compassionate Communities. That's the one that started in January and was to go through May. And as Juliana mentioned, unfortunately, when COVID hit, it did end up not being quite exactly what we had anticipated, but still was excellent. You will find in there all kinds of resources, including the fact that each month we covered a different topic and had a social worker who was typically working in a library along with a librarian as mentors for these teams. All kinds of content in text and video and podcasts. It's fantastic if you would choose to work through that together as a library, as a full staff, or even across the state. So those are the resources that I wanted to bring to your attention. There are, of course, many others, and I'm going to turn it back over then to Natalie to finish up.
Thank you very much, Lisa. And I think we will go back to Pat for the rest of the questions.
Okay. We got a couple of questions that are kind of similar. One was, on the whole, have you found local mental health organizations are open to working with you? And similarly, how did you get buy-in from your community, PR, and IT groups for all those initiatives for effective marketing, execution, and attendance? It's kind of all about buy-in.
So I can speak to that. When we released the mental health initiative, it was very important that none of this was required of any library system. That's not how we function. Anyone who participated did so because they wanted to, and they were required to come to the table with at least one community partner already that they had spoken to. So truly, the response has been overwhelming and really impressive of the number of community partners who want to be part of this project. You know, when the library can come to the table with a little bit of funding or resources or materials, it makes it easier for your partners to come alongside and have a joint vision. I also think the environmental scan and logic models that were part of this really helped libraries figure out who was in their community and how to go and talk to them and demonstrate that this was not a flash in the pan, this was a commitment.
And I kind of want to talk about what we did here at Monterey Park. It was actually never done before. And so it was kind of like a Hail Mary in regards to seeing if there would be interest in it. And luckily we had such a great community partner with such a vast network. We were able to get some kind of reach and to talk about this stuff. And I'm really excited because since COVID cut short what we had planned, because I actually had planned for a mental health fair, and I had about 8 to 10 providers that we were going to shove into our community room just for a drop-in fair, and then COVID hit. There was definitely, the resources were there, and as you make these partnerships, I think it's important to, you know, really rely on them in their networks to kind of spread the word. And at Pasadena, it was so funny because had we not done what we did, we found out a lot of our providers were kind of reinventing the wheel and doing the same thing and didn't realize, hey, this organization does what? Maybe we should work with them, because it was actually the Pasadena Mental Health Advisory Committee. We connected them with the Youth Leadership Network to basically take their information and take it to the Youth Leadership Network to talk to teenagers. So believe it or not, you could have all these people in your community, but they don't talk to each other. So you could actually be kind of like that connection to it. So, but you know, even if you're not quite sure, just do it and see what happens. You'll be quite surprised, but also don't give up. It may not work this time, but see what you can kind of, you know, rework, but get those partnerships, because those are going to be your bread and butter.
I want to piggyback a little bit on that, because I think what you said is so important there, Deb. And when we were looking at the libraries that were going to be selected to participate in the mental health initiative, we definitely had more than 20 library jurisdictions interested. So, you know, we looked at, has the library done the community research? Do they have a community partnership in place? Are they really looking at all of the data and the big picture? And then key, are they acting as a connector rather than as a mental health professional? So like Deb said, it's the library's, I think, strongest role to act as a community connector, to bring in all the different city departments and county departments and nonprofits and groups that are working with this, and help us collaborate and see where we can work together better. and be stronger and serve our communities in a more effective way.
Thank you, ladies. Right now, are there any more questions, guys? I've got a few more minutes. We'd love to hear from our attendees. Got a question. Has there been a strong positive response from patrons or communities to the implementation of the mental health initiative?
I'm going to say yes, especially with the Teen Mental Health Initiative. We got a lot of feedback from educators and even parents because, you know, they see that what's going on in their kids' life, and then just knowing that these resources are available, these programs are available, it's just almost kind of like a little bit of, it's a little bit of a relief for parents, because I didn't touch on this because I ran out of time. We actually led a program for parents that have teens that may be experiencing mental illness that was led by a professional to help them kind of figure out where they need to go with their child and how to get them help. But even teens themselves, that just getting their feedback like, oh my God, this is important. And I'm so glad this is available because I was able to give it to a friend. We actually had an email from one young person saying that's what they did, is they were able to help a friend find a starting place to try and get help. And I can't wait to share with you what's going to happen this year through Monterey Park, since we got cut short, but we got a lot of positive feedback from our city council, but also from our library users as well. So it may not be, may not be deluged with a lot of like, oh my God, this is amazing, but at least you're able to touch someone, and that's what it's about.
And I'd say here in El Dorado County, with our community hubs pivoting, the library has been able to step up, and it's been because of these relationships, because of this training, because of the pieces we were able to bring in. Take a Deep Breath Mental Health Club for the teens throughout this past year, multiple platforms that actually, when funding, we're in the middle of funding discussions right now, and our supervisors on the board, we're asking for a little bit extra money so that we can actually have community health advocates stationed full-time and part of our library family rather than part of the health family. And the supervisors are, our community hubs are so important. The training that they have, the collaborative efforts, all of these pieces are actually may result in some additional funding and definitely a recognition of the important piece that libraries bring to the table. And the fact that libraries are the heart of their communities. And that's where you can reach people that normally will not go to government agencies, who will not partake in what they see as government services. Oh, it's that nice lady at the library is going to help me get connected to what my family needs. The whole conversation has changed. And the staff feels more confident because they have skills in their pocket that they can pull out when they need. And it's been interesting. Many of our higher up admin are like, oh, you have people experiencing homelessness at the library? Like, yeah. So just opening up whole new conversations and being able to come to the table as knowledgeable, not mental health experts, just partners that work with other partners to get the resources to our communities.
I have to say too, sorry.
No, go ahead, Juliana.
Really quick add that I think it's so important that we also address that how powerful it can be for staff members to have a safe space to talk about mental health, and how their mental health impacts how they interact with the community, and taking a step back and understanding how our community members are coming to us from sometimes very difficult places as our staff, and acknowledging that and being able to see like the whole person at the job, it's powerful. And experiencing that together as a team, I would recommend participating in this with other team members from your library and from other libraries across the state. It just makes it more impactful. You have a chance to talk about it rather than you don't feel so alone, working on this on your own, tackling mental health. You're there with your community partners and your fellow staff members and other members of the library community across your state.
Mm-hmm. And I have to say the de-escalation trainings that went with this, that were held on site, Every single member of their staff participated, full-time, part-time, janitors where possible, security guards if they had them, admin. Everybody came to the table to be equipped with the same knowledge and that ability to move from compassion to action. It was quite remarkable in many library systems, the change that has occurred.
Well, thank you. I'm not seeing any more questions right now. We're very close to time. We've got 2 or 3 more minutes if anybody wants to throw up 2 more questions.
Yeah, I did see one comment about parents being the experts, and in the touch points training from the Brazelton Institute, that's actually the premise, that parents are the experts on their children and their lives, and we're here to come along beside them and offer whatever pieces we can bring to walk with them through the process. And that's just so vital and so important. And I think that's part of the having compassion and looking at the whole person. No judgments come to the table. And this mental health training really helps you learn to focus on what you're bringing to the table, which we need to be aware of in our interactions. I think that's a really important component and has helped my staff here in El Dorado County really be aware that all people are welcome here. And all people are experiencing life differently, and they're doing the best they can with what they have. And it's our job to support them.
Well, I'm going to say thank you to our presenters and let everybody know there's a brief break, and we'll start back at 2:30, where our presentation will be by Miss Amy Delpo from Denver Public Library, Beyond the Rocking Chair. So I look forward to seeing you all at 2:30. And thank you again, all of our new friends from California. We appreciate your efforts, and this was a great presentation. Thank you.